Hello everyone. I'll be talking about lead poisoning in children. So some background information on lead. Lead is a heavy metal. Lead has historically been used in many things, and this includes bullets, construction materials, as shielding material against radiation. So in the case of X-ray and nuclear medicine rooms, leaded gasoline, lead acid batteries, lead-containing paint, and water pipes. So what is lead poisoning? This occurs when you breathe or consume substances with too much lead. Many environments can be contaminated with lead, and this includes water, dust, food, and paint. And lead can cause damage to most of the organs in the body. Lead poisoning can happen in both adults and children. In adults, it causes damage to the nervous system, stomach, kidneys. In children, it affects the organs, but it also causes developmental problems that affect hearing, behavior, and learning. Approximately 500,000 children in the United States have a lead blood level greater than 5 micrograms per deciliter. And this is very concerning because a lot of research recently has shown that there is no safe level of lead in children. Even the most minute amount of lead can cause a lot of problems in children. And it is also part of CDC's Healthy People 2020. Their goal is to eliminate blood lead levels greater than 10 micrograms per deciliter. What are the causes of lead poisoning? So firstly, lead poisoning is completely preventable. It is most often through exposure to lead through contaminated air, water, food, or dust. It's more often seen in children because of their habit of putting inappropriate objects in their mouths. Lead-contaminated paint and dust are the biggest contributors for lead poisoning in children, especially in children living in houses built before 1978, as they often used lead paint. Water pipes are another big contributor, so you can either have lead pipes or brass and copper pipes that are soldered with lead, and the lead from these pipes can leach into the water. So for example, in the case of the Flint water crisis, you had insufficient water treatment and leached lead from the water pipes, contaminating the water supply. And this affected more than 100,000 Flint residents. You can also find lead in imported canned goods. In the US, lead usage has been banned from cans, but in other countries, they still use lead for canned food. And some herbal and folk remedies also contain lead. Lead poisoning is diagnosed through clinical signs and medical history. We'll go over the clinical signs in a bit, but medical history is pretty much exposure to some kind of lead. You can also look at the blood smear, which will usually show basophilic stippling, but the main diagnostic tool for diagnosing lead toxicity is blood lead levels. Before 2012, CDC considered 10 micrograms per deciliter to be the blood lead level of concern, but after 2012, new evidence suggested that no level of lead is safe for children, so currently CDC uses 5 micrograms per deciliter to identify children that may be at risk for harm from lead toxicity. So what are the signs and symptoms that you can see in lead poisoning? In children, you can see developmental delay, learning difficulties, irritability, loss of appetite, weight loss, fatigue, abdominal pain, vomiting, constipation, hearing loss, seizures, and pica. In newborns or in mothers who were exposed to lead toxicity before birth. You can see premature birth, lower birth weight, and slowed growth. At low blood lead levels, which would be less than 10 micrograms per deciliter, you can observe permanent neurological deficits, and this would include attention deficit disorders and decreased cognitive abilities. In one research study, they found that blood lead concentrations are inversely associated with IQ in children at 3 and 5 years of age. At higher blood lead levels, which would be greater than 20 micrograms per deciliter, more of the organs are affected, and some of the symptoms would include abdominal pain, constipation, and loss of appetite. At blood lead levels greater than 100 micrograms per deciliter, it can be fatal. And then chronic low lead levels exposure is much more common than acute high-level lead toxicity. So what are the groups that are at high risk for lead poisoning? And these would be the children from lower socioeconomic status, from racial ethnic minority groups, recent immigrants, children living in older housing, and parents working in places with lead exposure. So what are some of the prevention strategies? The main goal is to prevent exposure to lead. You can look for lead inside your home. Lead paint is the big culprit. So if homes are built before 1978, consider getting your house inspected by a lead inspector. And then if there is lead found, then consider remodeling or relocating if possible. In some cases, it may be better to seal in the lead paint rather than remove it, as removing it can cause a lot of lead dust and conversely increase exposure to lead. Lead dust can also settle on children's toys, walls, windows, so you can clean toys, floors, windows, and play areas. And certain food may prevent lead absorption in the body, and these would be foods containing calcium, iron, and vitamin C. So one of the goals of Healthy People 2020 is to eliminate childhood lead poisoning. CDC, EPA, HUD, and various other federal agencies have cooperated to implement a strategy to eliminate lead poisoning. So they identified 4 steps. The first is identification and control of lead paint hazards. The second is identification and care for children with elevated blood lead levels, and then surveillance of elevated blood lead levels in children to monitor progress, and finally to research to further improve childhood lead poisoning prevention methods. So how do you manage lead poisoning in children? In cases of chronic blood lead levels less than 45 micrograms per deciliter, you only need to use prevention strategies to prevent any further exposure to lead. So you would remove any sources of lead contamination, and this would reduce the likelihood of causing further problems. If the blood lead levels become greater than 45 micrograms per deciliter, then treatment is recommended, and you can usually treat with oral chelation therapy, and if that doesn't work, then you can use EDTA chelation therapy, which is an IV treatment. In the case of acute lead ingestion, where someone consumes a lot of lead, then the best thing would be gastric lavage. So you can pump out any remaining lead from the stomach. And these are the references.